So non-surgical treatment options for knee and hip arthritis, usually we start with some kind of strengthening and stretching program. This can be either accomplished through a home exercise handouts that a lot of times we have in clinic, or even through a form of physical therapy, where a physical therapist who's obviously has expertise training is working with you to showing you some things you can do on your own to get yourself better. Apart from physical therapy, a lot of times bracing is helpful. Obviously, bracing for the hip is not really applicable, but for the knee, there's something called a knee unloader brace, which can be very helpful for some patients. There's a variety of different medications, usually anti-inflammatory medications, either orally or even a topical, like an ointment type medication can be very helpful. Again, more so for the knee as far as the topical goes in the hip. Beyond that, a lot of times injections are helpful. Usually initially we do what's called corticosteroid injections, which is basically a steroid injection in the knee. Sometimes if the knee is pretty worn down, a lot of times the steroid doesn't work as well as we'd like. And then there's another thing called viscosupplements that we can inject into the knee. So these typically lubricate the knee and hopefully last closer to 6 months, if not longer. Injections are helpful with particularly knee arthritis and hip arthritis in the sense that you're putting a very strong anti-inflammatory medication into the joint. This is a type of steroid, and what it does is basically decreases inflammation within the joint, thereby reducing pain and improving function. There's a variety of other injectable substances that you can use to inject into the knee, more commonly, which is a viscosupplement. What a viscosupplement is roughly hyaluronic acid. It's some people call it rooster juice. It's made out of the coxcomb from chicken. But this is very effective in alleviating knee pain in that it lubricates the joint and helps out with pain. Typically this lasts longer and a lot of times seems to be at least a better option for some of my diabetic patients, where sometimes these steroid injections seem to elevate their blood glucose levels. Usually the viscosupplements are not associated with this, and again, if these steroid injections are not helpful, usually last quite a bit longer.